the government are calling on workers or anyone that has visited the port of Tauranga from since July the 21st, 11:59 p.m. to get tested for COVID-19. We of course know that this will affect thousands of kaimahi, many of whom are Māori. So with me now is the māngai for the Bay Plenty DHB, Graham Cameron. Tēnā koe te rangatira.
Tēnā koe Rebecca. Nui te mihi kia koe koutou katoa.
Now, we've seen lots of questions coming out on Facebook tonight, and of course in our kāinga, and especially here in Tauranga Moana. One of the main questions that people are asking are, do they have to pay for the testing?
Oh, kia ora, Rebecca. No, there is no charge for testing. That is for patients who are symptomatic, so if you have symptoms of COVID-19, or for those who require testing because they've been identified as a close contact with someone who has tested positive for COVID-19. Or thirdly, there's no charge if you've received a directive from the Ministry of Health to get tested. That obviously for here in Te Moana and Nui Atoi covers our whanaunga and our workforce at the Port of Tauranga who have been instructed by the Ministry of Health to get tested.
So where in the Western Bay of Plenty can people go to get tested?
In the first instance, what we're asking from the DHB is that people contact their own GP for testing. And if you don't have a GP, that's fine. Then phone Healthline, and that number wire is 0800 358 5453. That's 0800 358 5453. And Healthline actually are able to assess you and advise you where to go for testing. So that's in the first instance. If you're an employee at the port, then your employer actually will contact you and they're organising your testing. Now, for the Bay of Plenty District Health Board, what we're doing over the weekend is working with port staff, setting up a testing station that's going to be on site at the port. And that's to ensure that there's enough capacity to test all of the required workers. Because as you can imagine, it's potentially hundreds, maybe thousands of people who've been there in that period that you identified, which is from July the 21st onwards. So workers who have symptoms of COVID-19 have obviously already been getting tested at their general practices, which is great. I guess the thing I'd want to emphasise is we are going to be prioritising our port staff who've been on board a vessel in the last 14 days, and or those who've been in direct contact with crew that have come off a ship. And that testing is going to begin tomorrow, which is Monday.
So do we have a community-based assessment centre in the Western Bay of Plenty like the one that we previously saw at Bay Park?
Yeah, Kyle, no. Following the closure of the Bay Park community-based assessment clinic, then actually our GP, our general practices have stepped up and they've been managing testing. And look, that's been going really well. It's been efficient. They've managed the number of people coming in. So, we're confident in what they can provide. So that's why we say in the first instance, we want you to contact your GP. If you don't have a GP, then phone Healthline on that 0800 number. And again, you need to present with symptoms or have been given a directive to be tested by the Ministry of Health for that test to be free and no cost.
So again, we know that many of the port workers are our whānau Māori. So what advice do you give for our Port of Tauranga kaimahi or workers who are trying to get tested for COVID-19?
Oh, well, he te tuatai ka nui taku aroha ki a rātou. Anything to do with COVID causes anxiety and concern. So, I can understand how many might be feeling at this time. But the advice, that we have is, despite the Ministry of Health announcing on Friday that the deadline for testing of our port staff would be Monday at midnight, that actually we've been since advised that there's flexibility and no one needs to be concerned, that they're going to be penalised if they're trying to get themselves organised and can't do that before Monday. So, as I said, we're setting up a testing station that's going to be on site. Their employers will be the one who guide them to where they want them to go and get tested. And we're prioritising, of course, those who've been on board a vessel in the last 14 days or in direct contact with the crew. So I guess what we're asking is trust that we're in good contact with the Port of Tauranga. They're going to be providing direction to you if you're a kaimahi there, and they're going to tell you where they want you to go and when your testing slot is going to be.
So I've got two kind of final pārtai. Can the port staff or kaimahi still continue to work whilst awaiting results? And what else do whānau do to keep themselves safe?
Well, i te tuatai, your first question, absolutely. Yes, our whānau, they can keep working whilst they're awaiting results. In terms of keeping ourselves safe, well, you know, for any of us who've watched Jacinda or Ashley on the internet, then it's the same things, which is good hand hygiene, washing your hands, staying at home if you're unwell, and calling the GP or calling Healthline to get assessed. And then the other thing, of course, is the two things that have come in since the last time we were in lockdown is the COVID Tracer app. So I really encourage people to download that and to be using that, because that will make life a whole lot easier if the unfortunate circumstance you are a close contact or test positive with COVID. Then the final thing, of course, is there's been more encouragement around masks. When you're in a situation where you can't social distance out in public, there is an encouragement now to wear masks. They have been proven to be effective to reduce the transmission of COVID-19. So wash hands, make sure you're in contact and staying with your GP and staying home if you're unwell. COVID Tracer app, and think about wearing a mask. And for people who don't know, I guess the symptoms of COVID-19 are a cough, high temperature, at least 38 degrees, shortness of breath, a sore throat, sneezing, and or a runny nose, or a temporary loss of smell. So any one of those things, then make sure you ring your GP or Healthline.
Hei whakamutunga I tēnei kōrero. Do you have any advice for, you know, our whānau that might be feeling taumaha at this time, you know, anxious and nervous, because these are unprecedented times, and you know, who would have thought that we would have been in this situation when we, you know, celebrated the start of the year with New Year's and all of that? Do you have any final advice for them?
Hoki atu ki ngā tikanga o ngā mātua tūpuna, karakia, whakamoimiti. Again, you know, those things, a lot of them are moved online as well if you don't know how to do your own, so you can join with those. Also, you know, remember to focus on our tamariki and our mokopuna. Just like us, they might be feeling a bit anxious, so whānau time. And then the other stuff's about self-care, eh? So exercise and getting out in the environment, but keeping social distance, and taking time for yourself. And the other really important thing is, you know, mena ka pēhe atu ki a koe, tēnei taumaha. If you're feeling burdened, talk to someone. Talk to someone. Now, some of us might need help, and you can get that through your GP. Some of us might just need to unpack with good friends or with our whanaunga, but talking is really important at this time.
Kārawe, and just for those kaimahi at the port, if you have any further questions around what kind of support you might be able to access, please contact your employer, and I'm sure they'll be able to answer your guys' questions. Hei whakamutunga ngā mihi nui ki a koe, kei taku rangatira. I hope you have a great week, and I'm sure we'll talk again soon.
Kei te mihi ki a koe ripa, kei a koutou katoa. Tēnā koutou katoa.
Tēnā koe.